Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola from Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. Well, we continue in our series of Fast Facts on pain management. And last time we talked about the good and the bad. The prostaglandins that are good for you and the prostaglandins that aren't so good for you. And I asked a question at the end, which was, isn't there a way that we can get rid of the bad prostaglandins, the one that cause pain and inflammation, and hold on to the good prostaglandins, the ones that, do good things for us, like GI protection, renal protection, bronchodilation, and clotting? And the answer is NES. What do you mean NES? Yes and no. Well, there is a way. What we could do is use medications that block the production of the bad prostaglandins without necessarily blocking the production of the good prostaglandins. Well, how would we do that? Well, we know they're produced by different enzymes, right? So the cyclooxygenase 2 enzyme produces the quote-unquote bad prostaglandins, while the cyclooxygenase 1 enzyme produces what we call the good prostaglandins. So we really need a COX-2 inhibitor, right? Something that blocks the COX-2 enzyme but leaves the COX-1 enzyme alone. Do we have such a drug? Well, we had 3 of them. Bextra and Vioxx, but those two have been withdrawn from the market because they cause sudden death. That's one way to beat pain, but I don't recommend it. And there's Celebrex, but we realize that those drugs really don't do very well in treating dental pain. So we've relied on drugs like ibuprofen and naproxen, which are great drugs because they do an effective job in blocking the COX-2 enzyme and therefore blocking the production of those bad prostaglandins. But unfortunately, they also block the COX-1 enzyme. And so that's why ibuprofen and naproxen have good effects like less pain, less inflammation, but not so good effects like, as we may imagine, stomach upset, kidney damage if you use them for long periods of time, difficulty breathing, especially if you're sensitive to bronchoconstriction, and bleeding because you're blocking the clotting mechanism. So unfortunately, the drugs that we use to treat pain and inflammation have good effects, but adverse effects. But wait a minute, Viola, isn't there a way to get the good effects without the bad effects? Well, yes. Take the right dose so you can minimize the bad effects and maximize the good effects. The only problem is a lot of your patients believe, not trying to generalize here, but a lot of your patients believe when it comes to analgesics, more is better. And more is not better, as you might imagine, because taking more means more adverse effects, but not so much more good effects. And that's why it's very important to educate your patients on how to use analgesics correctly and appropriately so they get all of the good without so much of the bad. And that's our challenge as dental practitioners, dental hygienists, dentists. That's our challenge in educating our patients to realize that while these drugs are available over the counter and without a prescription, which leads many of your patients to say, well, they wouldn't sell them over the counter if they were bad for me. We got to educate them and let them realize that, yes, these drugs are available over the counter, but they need to be taken exactly as prescribed or exactly as directed so that we get the good without the bad. Well, how do I do that, Viola? And are there other drugs I can use besides ibuprofen and acetaminophen and all that other good stuff? Well, we're going to get to that in the next series of Fast Facts Pharmacology. But for now, my friends, this is the end of this presentation. We'll see you all soon in our next one. Until then, this is Tom Viola. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.